You are live, sir.
Yeah, Satish, I'll call you in 1 hour, man. Huh? I'm in a meeting, you know. Bapsi is come. I know that. I know that. Yeah, I got. I'll call you in an hour. Huh? Yeah, I'll update you in an hour's time. Huh? Thanks. Bye. Hi, friends. I'm Dr. Phani Krishna Ravula. I'm a surgical gastroenterologist with more of a interest and expertise in liver and pancreatic diseases. Um, I focus on aspects of surgical gastroenterology, GI oncology, gastrointestinal cancers, liver and pancreas problems, and liver transplant, and also in bariatric surgery. So today is the first FB Live I'm doing on behalf of Kim's Hospital, Kondapur. I'm heading the GI unit here. So today we'll discuss mainly about liver health in terms of what ails the liver health today, and also a bit about try to learn a bit more about liver cancer. And if you have any doubts or queries, you could always put it in your comment box, and I'll answer them. So, what ails the liver today? I mean, if you ask, of course, there's a wide variety of genetic conditions, metabolic problems, infectious diseases, drugs, and all that. But three main problems that affect the liver today are: one is alcohol intake. This is something that's been there for the past centuries. Then hepatitis B, chronic viral hepatitis, that is hepatitis B and hepatitis C. These are chronic viral illnesses. In addition, you have acute viral illnesses like so many viruses, like from dengue, your chikungunya, to a lot of other viruses, adenovirus and hepatitis A, hepatitis C. They can cause acute viral hepatitis. But when we talk about chronic viral hepatitis, it is by basically hepatitis B and hepatitis C viruses. So these viruses can actually infect the liver and lead to chronic liver disease. That is, normally an infection comes to the liver and it completely disappears after some time. But when hepatitis B and hepatitis C, they can live on in the liver for years and years and decades, and then eventually they can lead to liver cirrhosis and liver cancer. The third group is the biggest group among these three. Now, the predominant disease that is affecting a lot of us is the metabolic syndrome and fatty liver disease. All of us must have heard of fatty liver disease. uh, that is related to predominantly a dietary and lifestyle disease. Once upon a time, predominant cause of liver disease was in some parts of the world was alcohol. In some parts of the world was hepatitis B and hepatitis C, chronic liver disease. But now across the world, uh, the one predominant cause that occurs is fatty liver. It's also called NAFLD, non-alcoholic fatty liver disease. So I would say alcohol, chronic viral disease illnesses, and uh, fatty liver disease are the three predominant maladies affecting the liver. So let's look at them one by one. So alcohol, we all know that alcohol affects the liver. It not just affects not just the liver, but it also affects other organs like the liver. Your pancreas gets damaged by the alcohol. Your kidneys can get damaged by the alcohol. Your brain can get affected. Hello, చెప్పండి. Call me after an hour, Babu. Call me after an hour. Okay. So yeah, among that, so alcohol can affect several parts of your body. I mean, it can affect the liver, it can affect the pancreas, it can affect the brain, it can decrease your memory and your cognitive function, and it can lead to many things like gout and gastric cancer, colon cancer, pancreatic cancer, and all. In addition, the people who consume alcohol is very rich in calories. I mean, like when you look at sugar, all of us know that sugar leads to obesity. We know that. I mean, if you eat too much of sugars, leads to obesity. But 1 gram of sugar gives 4 kilocalories. So while 1 gram of alcohol gives 9 kilocalories. So it's a very rich calorie drink. And so when you consume alcohol, it not just the direct effects of the alcohol damaging your liver, pancreas, kidney, brain, the alcohol also contributes to the obesity. So, but obviously, despite all of us know that, but the alcohol drinking as a custom has increased throughout the world. I mean, anywhere you have, I mean, be it the rich countries, the poor, I mean, the rich or the poor, or educated, uneducated, all of us consume alcohol. So, is it possible to safely consume alcohol? I would, of course, say that avoid consuming alcohol, but if you have to consume alcohol, you should do it in a safe manner. So basically, the amount, the damage alcohol does to your liver depends on the blood alcohol levels. So if you can regulate and control your drinking, they are there are two enzymes called dehydrogenases: alcohol ethanol dehydrogenase, aldehyde dehydrogenase. So these hormones will actually metabolize the alcohol, and they will clear it from the body so that it doesn't damage your liver and rest of the organs. But how fast the alcohol is metabolized in your body is highly variable. It differs from person to person. So it differs to person. It differs from race to race, Caucasians versus Asians, men versus women, at age, and a lot of other genetic factors. So it could be variable for person to person. But broadly, so if you are unable to avoid consumption of alcohol and you have to consume it, if at all, it has to be done within the safe limits so that your blood alcohol levels do not reach beyond a certain level, and the alcohol levels within the blood are such that it doesn't damage the other organs. So how do you track it? I mean, so there are measures like 7 standard drinks per week and all that. But what is a standard drink? It's very confusing for a normal layperson to understand what is a standard drink, because you have tens and hundreds, I mean, probably thousands of varieties of alcohol, and the alcohol percentage in them is extremely variable. You could have like a 3%, 5% alcoholic beverage, while something like a whiskey would have a 40% alcohol. So how do you track the alcohol intake? There is a simple system which all of us can use, friends, to if you're a person who's regularly consuming alcohol, you don't have the whatever the social or the mental drive to completely stay away from it, but you want to drink it in a way so that it doesn't damage your organs. There is a system. So these you can there's a unit system. So an average man can drink about 14 units of alcohol in a week's time. Okay, 14 units of alcohol in a week's time. There's no specific data for Asians, but I would say 12 to 14 is the upper limit. And 12 to 14 units of alcohol is to be consumed over, it can't be consumed, it has to be spread out over at least 3 days. So if you drink all the 14 units in let's say in one day, that's called binge drinking. Your alcohol levels shoot up very high. The enzymes are not able to metabolize the alcohol, and the levels will go on to damage your liver, pancreas, and other end organs. So 12 to 14 units of alcohol, and women even lesser, 10 to 12 units of alcohol should be spread over a minimum of 3 days. So at least you should have three to four alcohol free days in the course of a week. And then the next question will be, okay, I understand that it's 10 to 12 units or 12 to 14 units, but how do you calculate the units? So there is a simple formula for that. So basically, in any alcoholic beverage that you take, there is it's legally required to show something called ABV percentage, that is alcohol by volume. So something like a beer would have 4%, something like a whiskey would have 40%, and depends on the various malts. So every alcohol has got different percentage, but at the there is represented how much is the alcohol. So the formula is ABV in percentage into the volume of alcohol you consume. Let's say let's say you having a beer that has 5% of alcohol, you have 2 pints of beer, which is 300 ml into 2, 600 ml. So 5 into 600 ml is 3000. 3000 divided by 1000. So alcohol by volume into the actual volume you consume divided by 1000. It's a very simple formula. Again, I'll repeat: alcohol by volume in percentage into the actual volume you consume divided by 1000. So, for example, 40% of alcohol you've had the 400 ml this week. So that's 40 into 400. So that's like 16,000. So it's almost like 160 units. So that's a huge amount of consumption. So it this was 40 into 400 is, yes, it's actually 16,000. So it's 160 units. So it's way beyond what this thing. So how you understand how by the percentage of alcohol and the volume you can decide the number of units, and this has to be spread out over minimum of 3 days. So if you can do that, you can practice safe alcoholism. But again, there is a caveat in this: if you are an absolutely healthy person, you can practice this. But if you already had an episode of pancreatitis, either acute or chronic pancreatitis, if you already had some liver issues like alcoholic hepatitis, if you have liver issues like fatty liver or non-alcoholic steatohepatitis, if you have underlying hepatitis B, hepatitis C, and or you have gout, so, and any other alcohol related health diseases, then you can't say that I'll take alcohol in safe limits. No amount of alcohol, however small, is safe for you. You have to completely abstain from alcohol. If you had alcoholic liver disease, alcoholic pancreatitis, alcoholic liver cirrhosis, fatty liver with NASH, or hep B, hep C, you should not take any alcohol. Like, for example, if you say, let's say I have hepatitis B, and the chance of my liver getting worse compared to a general population is, let's say, it's 10 times more, 10 compared to general population. While, so if I have alcohol, a person regularly consuming alcohol, your chance of liver getting worse is 10 times more. So you'd think that alcohol, you have hepatitis B and you're also consuming alcohol, it should be 10 plus 10, 20 times more. No, it isn't. It is like 50 or 100 times more. What I mean is, when you have already one underlying risk factor for the liver, and then you consuming alcohol, you're actually compounding the risk. It doesn't double or triple, it compounds a lot. So to summarize, alcohol, we should consume it up to 12 units per day, women 10 units per day. And you can use this formula: alcohol by volume percentage into the volume divided by 1000. And if you, this is only for healthy individuals, you already had some liver related issues or alcohol related end organ issues, it is mandatory that you completely abstain from alcohol. So hepatitis B and hepatitis C, Hep B and Hep C are, the disease burden is huge in this country. The incidence of hepatitis B is about 4 crores. That's in a population of 130 crores. It's estimated that 4 crores of us all have hepatitis B, and about 1 crore of the population, that is about 1 in 30. I mean, 1 in 130 for Hep C, and 1 in 30 for hepatitis B. So it's a very common problem. And these viral illnesses, hepatitis B, usually when you get it, you may have some jaundice or this thing during your childhood, it might have been noticed. And hepatitis C, you may never notice. So they affect your body. How do you get infected by hepatitis B and hepatitis C? It is through blood. People who've sometimes received blood transfusions, people, if you undergone surgery in conditions without proper sanitization and sterilization, it can be sexually transmitted, these viruses. Bodily fluids, when you have when bodily fluids transfer during for various reasons, when those are transferred, when you use sharps like in the barbers or tattooing artists, the contaminated needle tips or the blades, they can transmit all these things. And it can be transferred from mother to child also. Okay. But on the other hand, if a family member has hepatitis B, his C, and just physical contact, shaking his hands or talking to him, doesn't spread hepatitis B, hepatitis C. So once you get affected by these viruses, you can actually, once you get affected by them, the virus stays on in your body. In fact, the hepatitis B virus gets incorporated into your liver cell DNA, and a quiescent infection persists for many years. So after 10 to 15 years, I would say 5 to 15 years. In patients with hepatitis B, some of them, in hepatitis B, about 10% of them, 5 to 10% of them, can go on to develop liver cancer and liver cirrhosis. Likewise, in hepatitis C, you a larger percentage. Actually, the number of patients who get hepatitis C is less, but it's a silent infection that can live in the liver for many years, and after 5 to 10 years, hepatitis C infection can lead to liver cirrhosis and liver cancer in at about 80% of the patients whom it affects. So it's very important that you uh, one is stay away from those practices which lead to these kind of transmissions. That is unprotected sex, multiple sexual partners, and drug abuse, and unnecessary tattooing, and going to places the barber is using. You make sure that they take a fresh blade and all that. In India, basically, around 97, 98, they started screening hepatitis C in blood, actually. Before that, they were not screening for hepatitis C. So a lot of patients who did blood transfusions, patients who were on dialysis, uh, all these patients used to get hepatitis B and hepatitis C. And now, but if you are born after 2002, there's most likely that you are vaccinated. So now, after 2002, it's the hepatitis B vaccine is included in the national immunization program. So if you're born after 2002, you have been vaccinated with hepatitis B. But unfortunately, for hepatitis B is a DNA virus. For that, there is a vaccine. While for hepatitis C, it is an RNA virus, and there is no vaccine for hepatitis C. So if you are born after 2002, just get yourself checked. You have hepatitis. You most probably been vaccinated for hepatitis B. But if you're born before 2002, so do you need to get vaccinated? That's the question. So one thing is, everyone needs to, in maybe in once in 2 years, at some point when you're getting your general health checkup, make sure that in the general health checkups there are a lot of unnecessary investigations. These two, you mandatorily, they're very minor tests: hepatitis B and hepatitis C serology. You get it checked for the HBsAg antigen and anti-HCV antibody. So it's nice that you get checked, and if you're positive for any of these, don't panic. Just consult a gastroenterologist. Treating them in the current era is very, very simple. For both, you have simple tablets. They can completely clear your virus, but of course, they have to be supervised by an experienced gastroenterologist. So that's the thing. But if you're not vaccinated for hepatitis B, should you get vaccinated? I would say definitely in high risk professions, people who are healthcare professionals, people who deal with a lot of sharp objects in which there's a risk of poking yourself and all that. All the doctors, paramedics, it's mandatory. For other people, it is optional. But you can, it's safe vaccination. It's usually hepatitis B vaccination alone, or hepatitis A with hepatitis B is available. You have to take 3 doses at 0 month, 1 month, and 6 months. And that's something which you can do safely and keeps you protected from hepatitis B. The next is fatty liver. Fatty liver and NASH. So fatty liver and NASH is the biggest pandemic affecting the current generation. I mean, it is not just fatty liver NASH. It is like the entire metabolic syndrome. But basically, because fatty liver NASH is a lifestyle related disease. It's a diet and lifestyle related disease. So it's related to the kind of food you're eating. It is kind of related to your physical activity and all that. What is fatty liver? Fatty liver is when the liver gets replaced by more than 30% of the liver gets replaced by fat on ultrasound. You pick up as fatty liver. Most of the time, fatty liver is picked up only on ultrasound. So fatty liver can also occur with alcohol intake. Alcohol will damage the liver and cause fatty liver. Chemotherapy, we can damage the liver and cause fatty liver and all that. But when we talk about fatty liver, NAFLD, that means it's predominantly in patients who are not consuming that much of alcohol or little or no alcohol. And it's predominantly central obesity, diabetes, sedentary lifestyle, that related fatty liver. So fatty liver is basically the liver cells are replaced by fat. When they're replaced by more than 30% fat, it's picked up on ultrasound as a fatty liver, and that's what it is. What is NASH? So you see, fatty liver is extremely common in the general population. If you see in the urban population, it's about 30% of the people have fatty liver, and 50%, almost half the population has fatty liver. So in a room of people in Hyderabad today, if you take a room of people, almost half of us have ultrasound fatty liver, adults I'm saying. So if you have, let's say, in 150 of us have fatty liver, about five will have something called NASH, non-alcoholic steatohepatitis. That is, there is, the liver cells are not just replaced by fat, there is also ongoing injury to the liver, inflammation and injury to the liver, that is manifested by elevated liver enzymes, SGOT, SGPT. Other ways of checking this NASH is that basically, you on liver elastography, the liver stiffness will be increased. Normal liver stiffness is 5 to 6 kPa. On the special test called elastography, the liver stiffness will be increased. You can do an MRI assessment, and also you can do a liver biopsy. So most of the time we screen by enzymes, SGOT, SGPT, the liver enzymes. The liver enzymes normal value, if you go to your lab, it will say 40, but in the Indian men, it should be less than 35 AST and 35 ALT. It's called AST or SGOT, ALT or SGPT. It should be less than 35. In women, it should be less than 30. So if that is there, that means, okay, at least your fatty liver is not damaging the liver. So what is the implication if you have NASH? Once you have elevated enzymes and your doctor tells you have NASH, that means liver is getting injured. So over a period of 15-20 years, it becomes leads to liver cancer and liver cirrhosis. So the predominant indication for us as gastro liver specialists for liver transplant is actually now it is fatty liver and NASH, not just in India but in the whole world. How do you identify fatty liver? Fatty liver is usually picked up on ultrasound, and like I said, once you have an ultrasound fatty liver, you meet a gastroenterologist and get an opinion. There are some basic LFTs we can do, and if the LFTs are elevated, we can you do some other investigation like liver elastography. In some selected cases, very selected cases, we might do a liver biopsy. And once you have NASH, you need to work on it. So then what is this? See, people might think that, okay, I have fatty liver but I have no NASH. Majority, like let's say in a room there are 100 people, 50 have fatty liver. Out of that, 45 will have only fatty liver. But can we see that, yeah, I have only fatty liver and no NASH, I can relax? Not necessarily, because basically what does fatty liver show? That there's a calorie imbalance. You're taking too much processed calories. You are physical activity, you're burning less, too little calories. It is related to your dietary and lifestyle, and also, of course, there's a genetic predisposition as well. So fatty liver, hypertension, diabetes, high cholesterol, central obesity, risk of heart disease, risk of stroke, all this is one bouquet. They're all a bunch of lifestyle disorders which have the similar risk factors. Men are more likely to risk, people with central obesity, patients with sedentary lifestyle, smoking versus them. So all these bouquet, you have fatty liver, that means it's an indication that you either already have these other problems or you will get them soon. And on the other hand, if you put your efforts to fatty liver, you might think, why should I put all the effort, work so hard just to reverse one fatty liver? Because when you reduce your fatty liver, reverse your fatty liver, you will actually reverse all the other this thing, improve your longevity of life, and reverse your diabetes, reverse your hypertension, reverse your cholesterol levels and fatty liver, central obesity, increase your lifespan, reduce the risk of cancer, heart attack and stroke. So that's the importance of fatty liver. So once you get fatty liver, I mean, we see a lot of people who come to the OPD. I got fatty liver. I'm having sleepless nights. I'm getting very anxious. It's not something to really panic about. Panic about, at least, because fatty liver doesn't affect you in the short run. If I have fatty liver today, I'm going to be okay for the next 10 years. And this next 10 years, I have a window to correct my lifestyle, cut down the alcohol intake. Diet means you have a healthy diet. All carbohydrates you should reduce. I mean, not just your rice, chapati, you have to have a little, but reduce the amount of rice and chapati you have. All the carbohydrates, your puri, dosa, bread, biscuit, haldiram, cookies, cake, sweets, french fries, chips, burgers, the bread, the pizza bread, burger bread, anything sweet, candies, chocolates, fruit juices, cakes, cupcakes, cookies, all that. Anything, all comfort foods, ice creams, all comfort foods, anything that's general rural life is, if you are craving something and if it's like really yummy and a comfort giving food, it is not healthy for you. So if you don't eat this, what should you eat? You should focus on fiber, kira, I mean, kira salads like beetroot, radish, carrot, kira, cucumber, and all that, and salads and green leafy vegetables, all the green leafy vegetables. I mean, మన బెండకాయ, దొండకాయ, సొరకాయ, కాకరకాయ, all the leafy things, palakura, akura, all those green leafy vegetables, except things like which grow under the ground, like potato and chamadumpa, all that. Those are again high carb, but all the green leaf vegetables you can have as much as you want. They don't add to your calorie to this thing. And proteins, chicken, egg, fish, pulses, dal, sprouts, paneer, tofu. These proteins you can have in moderation. This it should never be a lot, because even a high quantity of proteins can also get converted to fat. So this kind of a diet, a physically active lifestyle. Physically active lifestyle means not I'm doing my household work all day, I'm going to office and doing surgeries all day, or that doesn't count for physical work. That is your basic metabolic function. The whole day your heart is beating from 24 into 7, and you're breathing, all that is also then exercise. But what is physical exercise means? It's exercise that burns your calories. I mean, it's important to one is important to build up your muscle mass, improve your muscle mass to fat ratio, reduce the belly fat. So most of the Indian men, we see that they are not obese. I mean, your overall weight will be some 5-7 kilos. So we'll think I'm so healthy, I'm only 5-7 kilos overweight. No, the problem is all the fat is in the central compartment, obesity. So the central obesity, if you do the patients MRI for patients with central obesity, you'll find that the when you do an MR fat estimation of the abdominal compartment, they'll have a lot of visceral fat. And so you will see many of your relatives who are actually looking thin, and you'll wonder why these people are so thin, but they have all diabetes, hypertension, fatty liver, and all that. That is because they are skinny fat. That means patient is not obese, but he's centrally obese, and he has very little muscle mass. So improve your muscle mass, reduce your calories, and cut down your belly fat. For Asian men, it is the most dangerous. So we do a lot of bariatric surgery. In bariatric surgery also, the criteria for Western India are different. In Western criteria, morbid obesity is defined as 40. While for in India, it's defined as 37.5. Morbid obesity with comorbidities is defined as 35 in the West. It is in India 37.5. Severe obesity is defined as 30 in the West, while in India is 27.5. What I'm saying is, the standards for us Asian men, and especially Indian men, we have the pot belly, the abdominal obesity, and that is a very unhealthy form of obesity. That's why we are the diabetes capital of the world, and the fatty liver capital of the world, and this is going to be a huge burden. So as a surgeon, I deal with the fatty liver patients because one is they come to me for fatty liver, and then we see them as when they have obesity, when they have a morbid obesity, a huge so morbid obesity is when your BMI is more than 40, or BMI more than 37.5, or BMI more than 32.5 with obesity related comorbidities, or you have a waist circumference more than 100 centimeters, and you have obesity related issues like type 2 diabetes, fatty liver, obstructive sleep apnea, hypertension, high cholesterol, breathing issues. So all these issues when you have, so we offer bariatric surgery for them, like sleeve gastrectomy, mini gastric bypass, Roux-en-Y gastric bypass. These are all not experimental surgeries. There's absolutely no need to be scared of them. Patients have a lot of unnecessary fears that I get this done. Some news somewhere I've heard. Those are the rare one-off cases. Like it's like there might be someone several years back. There was some African patient who who was 500 kilos, who had a complication post bariatric. There are a lot of people who have some complications, occasional, even rare, post liposuction. Those are liposuction and all are different. They are just cosmetic procedures. Bariatric surgery is a life-changing surgery. We alter the metabolism of the body. After the surgery, it cures your diabetes, cures your hypertension, and reverses your fatty liver and makes you a healthy person. The cosmetic part is just a side effect. This is not cosmetic surgery. It's a life-saving surgery. That's why it's actually covered under insurance now, bariatric surgery. And then the other group of patients, obese patients I deal with are when you have fatty liver and they come with liver cirrhosis. When you have liver cirrhosis, see, fatty liver is the one cause of cirrhosis where if you recognize early, when it's in the three stages, child's A, B, C, so let's say call them stage 1, 2, 3. When your child's A or early stage cirrhosis, just by weight loss, you can actually reverse and sort of, or hold the disease there and not make it, prevent the progression. So you can stop the disease right there, or reverse it to some degree by losing weight. But once you go to stage 2, stage 3, uh, patients get very sick. They actually lose weight. Many of the patients who come in stage 2, stage 3 cirrhosis will tell that we were obese 10 years back, but now we're really losing weight. They become, all muscles become wasted, and they become sick looking, and they have multiple decompensated liver disease like jaundice, ascites, encephalopathy, and all those problems. And in these kind of patients, liver transplantation is done. We offer cadaveric and living donor liver transplantation. Again, these are not experimental therapies. These are things that have been, both bariatric surgery and liver transplant offered by us surgeons. They have stood the test of time. They've been around for now. Liver transplant has been around for at least 40 years. Bariatric surgery also for the same time, and they have given excellent long-term results with long outcomes. So, to conclude, I would say that uh, what you should do is uh, consume alcohol, avoid consuming alcohol, especially if you have already had some liver related or alcohol related problems. If you consume, stick to 10 to 12 units, 10 for women, 12 for men, and calculate the units by the ABV formula. When you go get your health checkups done, get yourself checked up for hepatitis B and hepatitis C, and if you have, consult a gastroenterologist. uh, to avoid chronic viral infections, safe sex practices, avoid drug abuse, IV drug abuse, and uh, when you go to barbers, artists, or in surgeries and all that, practice hygiene. And fatty liver, alter your lifestyle. Fatty liver is, of course, a major thing. Alter your lifestyle. Majority of us need to listen to this advice. Cut down your carbs, increase the fiber in your diet, have a physically active lifestyle. And of course, if things go to end stage, I mean, you are morbidly obese, that when you're morbidly obese, you can't lose weight just by diet and lifestyle alone. uh, and you When you have liver cirrhosis, again, it's not reversible, it's a progressive process. Then you would need to consult us experts for a bariatric surgery or a liver transplantation. Of course, bariatric surgery is not just for morbid liver problems. It's more for, it'll reverse your diabetes, completely reverse your type 2 diabetes, hypertension, obstructive sleep apnea, and many other, I mean, osteoarthritis. So a lot of health issues get controlled and reversed by bariatric surgery. While liver transplantation, we do exclusively for hepatitis B, hepatitis C cirrhosis, alcohol related cirrhosis, and fatty liver cirrhosis. These are the most common. They, around 90% of the transplants are done for these three indications. Um, I'm Dr. Phani Krishna. I'm a GI surgeon. I done my MBBS and MBIS from JIPMA, Jawaharlal Institute, which is like India's number one institute. AIMS and JIPMA are the top institutes. So it's one of the top institutes of this country. So I did my medical school and my post graduation in surgery there. Subsequently, I trained at SGPGI, which is India's premier institute in the North India, where I specialized in surgical gastroenterology. And I've had a special interest in hepatobiliary surgery. I've trained in Japan in HPB oncology at Kurume University, and I've trained in for 2 years in the UK at St. James University Hospitals, which is the largest hospital in Europe for many decades. Uh, I trained in liver transplant, and then I trained in Korea for living donor liver transplantation at the Asan Hospital, Korea. Subsequently, so my interest is mainly, in addition to the regular surgical gastroenterology work, I'm focused on liver and pancreas work, liver transplantation, liver cancers, pancreatic cancers, complex GI cancers, reoperative surgery kind of stuff. And also, we are very much the field of GI, we're very much into laparoscopy and robotics in these days. So we offer, from abdominal wall reconstruction for complex and recurrent hernias to bariatric surgery for those group of patients. So I was in post training in India and abroad. I worked at Asian Institute of Gastroenterology for several years, about 7 years. Then I was at PACE, and now I'm at KIMS Hospital, Kondapur. We have a big team of about 7 surgeons here, all dynamic surgeons who are special subspecializing in every aspect of gastroenterology, and I'm heading the team. For any queries or this thing, you can always meet us. Probably there's been some link displayed in the chat below. Please use that to seek an appointment and contact me. If you have any doubts, you can fill it up in the chat box, or reach out through this link. We will DM you. Thank you. So yeah, Anila has asked a question. My husband drinks alcohol regularly. So again, we had this question. Maybe she joined a bit late. So alcohol in the only 12 units is the upper limit, Anila. So that's like the formula which you need to. This thing is your husband. If first thing, he has to have the initiative. If you get himself checked, if he's got fatty liver, if he's got diabetes, if he's got any pancreas related problem, if he's got high cholesterol, my recommendation is to completely stop alcohol. But if he has to consume alcohol, it should be limited to 12 units per week. 12 units per week, and with at least 3 alcohol free days in a week. So 12 units, you must be wondering how to calculate units. We already discussed that. ABV on every alcohol bottle, whatever it is, beer, rum, whiskey, whatever, the ABV percentage will be there. ABV percentage, you can write this down if you want. ABV percentage. So let's say beer has 5%, 5 into volume consumed. So if he has 600 ml of beer today, into 600 divided by 1000. So ABV into volume divided by 1000. So that gives the number of units. So let's say you have 5% beer, you consume for 600 ml. So 5 into 600, 3000 divided by 1000 is equal to 3000 divided by 1000. So it's 3 units. So 3 units. So alcohol, basically, you can safely consume alcohol if you don't have any major health problems, but the alcohol levels need to be kept low so that the body's two enzymes, they metabolize the alcohol. So at only 12 weeks, 12 units per week maximum, that too spread over 3-4 days, ideally spread over 3-4 days, at least 3 alcohol free days per week. But if your husband, I don't know how old is he, and if he's been consuming alcohol regularly, you can just come and meet us once. And if he has fatty liver, if he has alcohol related liver damage, which you not show up, I mean, if your liver, if I'm consuming alcohol daily, my liver is getting damaged, I'll be happy. I won't have any symptoms at all. Later on, 10 years later, when your kids are growing up and all that, you'll have swelling in the feet, jaundice, you'll go to a gastroenterologist and they say that liver is cirrhotic. So you should get yourself checked. But to answer you, like you said, like this formula, ABV into volume divided by 1000 and 12 units per day, spread over a minimum of 3 days. And if he has alcohol related liver, pancreas issues or other liver related issues, he should not consume alcohol at all. You can actually get him to us and we can just do a general checkup and then counsel him. There's a lot of facts like this: drinking coffee, does it help fatty liver and all that. Caffeine doesn't do any good or harm to the liver. There'll be a lot like people, does amla detoxify the liver? Simple. Just eat healthy, eat fiber, less carbs, less processed carbs, less sugars. That's it. That keeps your liver healthy. Coffee doesn't do any good or harm the liver. If you search on the internet, you'll find some 200 news articles and these things confusing you. It's beneficial, it'll cure your liver, all that. Forget about all that. There's no detoxifying drugs or agents for the liver. The best is a detoxified lifestyle, which is avoid consuming alcohol, consume it within safe limits, and healthy diet, which we discussed previously in the chat. So now, yeah, I think Vasundhara Sriram has asked this question. So 12 units means how much? We can display the slide. I'll just read to see if I can present the slide from your computer. I mean, probably I'm not able to share it, but what I'll tell you, units. How do you calculate units? I've already covered that. So for men, it's 12 units. If you have no alcohol-related health issues, the units, Vasundhara, is like basically your ABV. When you look at an alcohol, like let's say gin, beer, any drink will have a prominently written ABV percentage. That means alcohol by volume. Okay. So alcohol by volume percentage, it'll be mentioned. It'll be like beer 5%, gin 10%, whiskey 40%. There's some vodka and all will be like 50-55%. So it's like the ABV into volume you have consumed in a week. Let's say you want to calculate in this week. I've how much you've drunk. You drank today. You have drunk 2 pints of beer today, 2 pints tomorrow, 2 pints day after tomorrow. So that's 6 units of beer. Hmm? So that 6 units of beer means 5% is the beer. So each beer, let's say it's a 300 ml. 300 into 6, 1800 ml. 1800 ml into 5%. Okay, 1800 ml into 5 is 9000. So divided by 1000, so that is 9 units. Okay, ABV percent into volume divided by 1000, that will give you the volume. So you calculate by that very simple formula. You can go to Dr. Phani Krishna Ravula safe limits of alcohol. You'll find another talk of mine on online which gives you a clear explanation. So that way you can calculate so cumulatively in a week how much you're having, and that alcohol should be spread out. It can at least 3 alcohol free days you should have in a week. If you binge drink even 12 units in one night, your the values will go very high, and then it'll affect the brain, liver, pancreas, and other end organs. Yes, tattoos and piercings can lead to risk of hepatitis B and hepatitis C. So you inadequate sterilization. You go get a tattoo and a piercing. If they do a unclean, unsterile needle or something has been already used on somebody and without proper sterilization, you can get infected with hepatitis B and hepatitis C, and that can silently damage your liver over 5 to 10 years, and you can have liver cirrhosis and all those problems. So think again whether you want to get a tattoo or a piercing. If you have to get it in a very good place where they show you that they've use a fresh needle or a good sterilization process before they do the tattoo or piercing. So tattoo or piercing can lead to hep B and hep C infections. That's what I was trying to say. Yeah, wasn't it? I mean, first thing I think, yes, you there are options for person who wants to. First thing, if you are really serious about it, you and your husband is for the step one is it should not be you. The husband should be asking these questions. First step is getting yourself evaluated. Getting yourself evaluated. Definitely, if you're, we'll have to look at your how your liver is, or if you had any previous pancreatitis and all that. So if your liver is damaged or pancreas is going on, you have to completely stop. Okay, in the initial week, you'll get some withdrawal symptoms. We'll give some medicines for it, because if a person who's suddenly regularly drinking alcohol, he'll get some withdrawal symptoms. But it's very easily manageable by some medication. So they'll get tremors, they'll get hallucinations, they'll get irritable and all that. But that can be managed with medication. But uh, if those things are okay, yes, I mean, you can definitely gradually withdraw from it. If you have no health problems related to alcohol, you can do a gradual withdrawal. That is a good idea, because see, remember, alcohol doesn't just damage the liver, pancreas, brain, kidneys, increased risk of cancer, increased risk of gout. Alcohol also contributes to obesity. So when a person, alcohol is very rich in calories, and this thing. So my recommendation is, if you think that is a serious addiction problem, you just come and consult us and get a his liver health evaluated first. First, you get it evaluated, then we can see how serious the problem is. Just with family support, the three levels. One is with family support alone. And then next is with just the psychologist and psychiatrist counseling alone. Third is you can get them admitted in de-addiction centers. So depending on what the patient's family support is, what his mental status is, there are three steps to it. But yes, if your liver is not damaged, you can actually gradually withdraw from alcohol. Yeah, Rishabh. So fatty liver can progress to liver cirrhosis and liver cancer. Basically, once you have the liver turns fatty, like I said, in a population of 100 people, if you take 100 people randomly in a room, urban citizens, I would say 50 of them will have fatty liver, and fatty liver is so common. So if fatty liver among fatty liver patients, about five of them will have NASH, non-alcoholic steatohepatitis. So this NASH patients, they can progress to develop liver cirrhosis and liver cancer. So any patient with a fatty liver is at a risk of progressing to liver cirrhosis and liver cancer, but it is like out of 55 patients, that means about 10% may develop liver cirrhosis or liver cancer. So you should get yourself checked, get your LFTs checked. And patients who are type 2 diabetes with fatty liver, patients who are morbidly obese, BMI more than 32.5 with fatty liver, men with fatty liver, patients with family history of cirrhosis in the family with fatty liver, then patients who are consuming fairly good amounts of alcohol and fatty liver, patients with hepatitis B, hepatitis C, and fatty liver, these kind of people are at a higher risk. So yes, you should be aware that not majority of the fatty liver does not progress to liver cirrhosis or liver cancer, but any fatty liver patient is at risk. So you should get himself checked and do the necessary dietary and lifestyle modifications to get it corrected. And of course, you have fatty liver with NASH. That means you have fatty liver, your LFTs show SGOT, SGPT are elevated, and then the liver elastography shows the liver is getting stiff. Then we also give some medication to reverse the fatty liver. But predominantly, it is diet and lifestyle related. Yes, I mean, yeah, medications can affect the liver. There are a lot of medications. Steroids can affect the liver. Drugs taken for arthritis, they can affect the liver. Chemotherapy drugs can affect the liver. uh, yeah, they can. I mean, and in fact, a majority of drugs can have idiosyncratic. That means any drug can occasionally affect the liver and cause enzyme elevation, but there are some drugs which are consistently, if you take them, they will consistently cause. So yeah, but this can something that can't be done on the Facebook. But you just, if you have any concerns, you can get your LFTs checked, get an ultrasound and checked, and also meet a hepatologist or liver specialist, and just have a look. Let him have a look at your medications. We can sort out which ones, if any, can affect the liver. One important thing I'd like to tell you is there is no alternative to a healthy lifestyle, avoiding alcohol, eating, cutting junk food and processed food. People want to, don't waste your time on unnecessary Ayurvedic, homeopathic, and all medication. I mean, yeah, Ayurvedic, homeo, Unani, Siddha medication. I see they are predominantly, all of them work by placebo effect. The people who talk about them, most of them, they have no idea about liver diseases. They just, it's just desperation to sell medicines. But if you want, you take for rheumatoid, some arthritis, and also even that I would avoid, but it's your problem. But if you have jaundice or liver problem, please avoid taking all non-allopathic medications. See, allopathic medications don't do any magic. If you have jaundice, if you have hepatitis A infection and come to me, I'll say nothing to be done. You sit at your house. This hepatitis A will, the jaundice will go up and come down within 2-3 weeks. Sir, can you bring it down faster? No. Allopathy is scientifically tested and proven that it will not bring it down any faster. But most of the time you'll recover. But and there are some diseases of stage that I'll say you have you can't reverse with medicines. You need a transplant. So because allopathic medicine is scientific medicine, when you take these things like for jaundice, one red pill, for liver cirrhosis, one blue pill, and all that nonsense, but basically what you are doing is, we see so many patients who, for cancer and liver problems, they take Ayurveda or Siddha, homeopathy, some native medicine, local medicine, and they end up in drug induced liver injury. So allopathic medicine, I do agree, it's not a remedy for everything. There are many diseases which we can't cure, I accept that. But at least the scientific, we know that what we can cure, what we can't cure. The people, like, when you, for liver problems is something I would strongly recommend people to avoid all detoxification regimes, all unnecessarily tablets, capsules, all sorts of rubbish which is supposed to help the liver, improve the liver. Just stay away from alcohol, consume it levels, and get a healthy lifestyle. What keeps your liver healthy keeps your heart healthy, decrease the risk of cancer, it keeps diabetes away, it prolongs your life. So liver health is body health. I mean, diabetics, alcohol can impact, because, see, like I said, alcohol worsens your sugars. Alcohol affects the nerves, causes neuropathy. Diabetes causes affects the nerves, causes neuropathy, and alcohol will worsen your sugar control. Alcohol is very rich in calories. 1 gram of sugar gives 4 kilocalories. Alcohol gives 9 kilocalories. Alcohol breaks down into something called triglycerides. They are directly spike up your cholesterol and all those cholesterol related heart disease, stroke, and all that. So, and if you have alcoholic liver disease and you have diabetes related fatty liver disease, the impact is not doubled. Two problems, it is tripled or 5 times. So, that's what, if the person has diabetes and obesity and and is still consuming alcohol, you have to seriously reevaluate your life and your choices. Type 2 diabetes, I mean, can smoking is like from hair fall to eyes to hearing to mouth cancer to lung problems, heart problems, stroke to GI cancers, blood, everything. I mean, there's nothing on which smoking has a beneficial effect. If somebody asks me, in fact, should I drink alcohol with a healthy young guy, 20-year-old guy comes that, can I have alcohol, little amount of alcohol in safe limits, or should I smoke? I'll definitely say smoking is very bad. And diabetics, I mean, with respect to liver, uh, the smoking increases the risk of, basically, it doesn't lead to cirrhosis, but in patients with cirrhosis, it increases the risk of cancer. Likewise, in type 2 diabetics, can smoking will perpetuate increased risk of liver cancer, pancreatic cancer, stomach cancer, and lung cancer. So smoking is something which is not to be. Alcohol also, at least you can, some within safe limits you can try and consume, but smoking is a strict no. Smoking is poison. Yes, fasting can help fatty liver, but it's not just, like I said, a lot of us are lean nash. That means you're not very obese, you look thin, but you still have fat liver because our visceral fat is high. So when you fast, what happens is you lose weight. Definitely it improves the fatty liver, but over a period of time, your muscles also get shrunk, so that is not good for the liver. So in fact, patients who have rapid weight loss due to cancer or pancreas problems, they develop fatty liver, rapid weight loss also. So fasting does help fatty liver in the short run, but in the long run, the best solution is reducing your caloric intake. Intermittent fasting, it's debatable. I mean, it has some negative impacts like gout and all that, but it has beneficial effects also. I would not really condone that intermittent fasting. You can do that, but in addition, increase your protein intake and increase the muscle mass. Don't focus exclusively on weight loss. It's weight loss plus muscle gain. It's the ratio of the skeletal muscle, your muscle percentage in your all your upper body, the legs, the abs. Muscle should be built up and lose weight. Only losing weight by starving yourself may be detrimental. So, okay, Anirudh, is it some skin conditions can affect the liver health? Not really. There are a lot of skin conditions which can they show that liver can also be affected in them. Like for example, psoriasis or connective tissue disorders, or some lichenoid disorders. So when you have the skin condition, it could be a marker of underlying liver disease. So when you, let's say, what are the things of liver cirrhosis? In liver cirrhosis, you have gynecomastia, your men's breasts enlarge and they become painful. Then you can have red spots all over your body, and you can have muscle wasting. So it's not that skin condition will can reflect liver health. I mean, I okay, sorry, I got you. Skin conditions do reflect liver health. So there's some skin lesions which can actually point towards an underlying liver disorder, especially, like I said, these kind of lesions: psoriasis, lichenified lesions, severe muscle wasting, severe dry skin can also be a feature in patients with advanced cirrhosis. So I think there are many new advancements in liver health. I mean, let me talk about in terms of liver cancer. Liver cancer is a very specific. It's not like a general cancer which any cancer specialist who treats some breast, limb cancer, breast cancer, ovarian cancer can treat. Liver cancer is to be treated by people who specialize only in liver. Liver experts should treat liver cancer. There's a lot of advances in liver cancer, because liver cancer occurs mainly in patients with liver disease. So majority of the patients with liver cancer already have either hepatitis B, hepatitis C, alcohol, or fatty liver disease. So in these patients, there's so many new technologies, wonderful technologies There are we do things like we don't need to operate all these cases. Of course, surgery, we've gone from, we are really complex surgeries, now we are able to perform safely with less than 1% mortality. We're able to do them laparoscopic, robotic. We're able to do parenchyma preserving procedures. When there's tumors in the liver, we can do microwave ablation, radio frequency ablation. Those are newer technologies. We have technologies like transarterial chemoembolization, transarterial radioembolization. Without surgery, we can control the liver cancers. Then we have robotic surgery and laparoscopic surgery, which we can patient can recover within 2 days and go home without a scar. And there are new immunotherapies also as a big thing in liver cancer. So there are wonderful immunotherapy drugs, and there are also good targeted therapies like lenvatinib, sorafenib, and a lot of immunotherapy drugs which can, even in advanced cirrhosis, now we're able to give a good prolong their lifestyle significantly. So there's a lot of advances in liver cancer, advances in liver health. That's a huge topic. So thanks, guys. I think we've run out of time. uh, Absolutely. So we've run out of time. There's a lot of questions. I mean, if you ever have any the your alcohol related problems in your family, or fatty liver related queries in your family, please feel free to consult us. And my channel is there, Gastro Health Dr. Phani Krishna. You can use the channel. There's a lot of information on liver diseases, pancreatic diseases, liver cancer, and all that. You can use that. Or if you actually have some serious concern, it's better not to do your own experiments, or you'll find anything on the internet. But it's better to consult a gastroenterologist, get yourself evaluated, and take the advice. Especially, I'm talking about liver tumors, pancreatic tumors. These are highly, highly specialized areas which should be dealt with people who are dealing all their life only in those diseases. They can't be dealt by general specialists, because there's so many advancements which you have to keep track of. So any of these problems in your family, please feel free to consult me and my team at Kim's Kondapur. Thank you, guys. Thank you.